next speaker is Jane Herbert, who will be talking to us about a matter that's close to my heart as well, Father's Matter, improving child outcomes by supporting fathers. Thanks, Jane.
What makes a good dad? Traditionally, we've talked about dads as being the primary income earner for the family. Things have been changing. Over the last few decades, we're increasingly asking dads to be active in their children's lives, to be emotionally involved and engaged. This is increasing the demands on dads at work and at home, and these increased demands increase stress and create more conflict. It's a lot for dads to deal with. But we also know for the best possible outcomes, children need their dads, and we need to support them. We need to make them the best dads that they can possibly be. So my research, which is based here at Early Start, is looking to understand what is the unique role of fathers in child development. And I also want to know what systems and supports do we need to put in place to ensure that dads can be present for their children. So we've been doing parenting research for such a long time. Surely we know this. Well, we don't, because we've focused on mothers. Mothers have been regarded as the most important factor for children's healthy development. We know a little bit about dads, but mostly mums have been available to take part in research, have been engaged in the things that we're doing, and they're available at the right time of day to take part in the studies. So we've neglected dads. We know that father involvement is important because when information has been collected, it's usually been about the number of hours that are available. So how often is dad at home? How often is he actually looking after the child? And dads who are more involved, the children tend to have better outcomes. But time is not limitless. We can't keep just saying to dads, spend more time with your children. And also, is it just the amount of hours, or is it actually what they're doing? What is quality when dads get together with their children? We also have a lot of people who are suggesting at the moment we've got father-inclusive practices in health and education. That's great. We're trying to get dads more involved, but a lot of these resources have actually just been derived from things we've learned from mums. That's not fit for purpose. We need to hear from dads. So the research we've been doing at Early Start has got three main themes. And the first thing, we're talking about what happens at the very beginning of the parenting journey for fathers. We've been doing it, we've just completed a survey with primary healthcare workers who work with new and expectant dads. So we've completed a survey with GPs, midwives, and early childhood nurses, asking them, how do you support dads? What do you ask them? We find that almost all of these primary healthcare providers feel it's really important to talk to dads about mental health, about the risk factors and their social supports. But over 40% of them never ask these questions. They say it's important, but they don't do it. There are structural and systematic barriers for these primary healthcare providers. Dad is not part of their job remit. Their job is to look after mum and baby, not the family unit. They simply don't have time in their short sessions, and often they're scheduled at times where dads are not available. Our primary healthcare providers have also told us that the resources available don't really fit what they want to ask dads. They feel uncomfortable asking these questions, and they're not really sure of where they want to refer dads on afterwards if there is a problem. Our second line of research is working directly with dads, asking them about their parenting and their work-life balance. Dads have reported they're actually quite surprised that their kids like spending time with them. They also like to be an active parent, but there are barriers for them. They have concerns about how they're placed in the home. They acknowledge that their skills and confidence are not as good as they would like it to be. And they often, even those who say that they're actively engaged in the home, report that they're an assistant or a helper. They're chipping in to care for their child. Many of them have also reported that work is a barrier for them as being an active parent. And although they know that there are flexible working opportunities at work, they are reluctant to ask for them, that there is a stigma at work, especially when you make those requests as your child gets a little bit older. And finally, we're looking directly at the interactions that dads have with their children, bringing them into the research lab and observing them having fun together. What we're finding out is it's not rough and tumble play is the only thing that dads do. Dads are engaged in a lot of activities, and even something as simple as book reading, they do differently from mums. They talk differently and engage with their children differently. Their behaviours are unique and they are important. Why is this impactful? Why is this important? Well, we know that parenting transmits across generations. When we make changes, when we support one dad, when we provide more information to them, look after their health, they not only have an impact on their child, but future generations to come. We also know that we need to invest more time and energy into developing father-based resources. So we need to listen to dads and we need to talk to the practitioners who work with them to make sure that all our resources are appropriate, acceptable, and available at the right time on the parenting journey. And finally, we need to collect more data about actual evidence of what dads do differently than mums, because this is really important information to build up our resources, to support organisations, governments and policymakers, to not just say they have flexible working opportunities and parental leave policies, but to actually support those policies and encourage people to take part in it. Over the next 3 to 5 years, we're building this, this actual Fatherhood Institute idea at early start. We want people engaged. We want dads supporting other dads. Thank you.